Question 1. Miss Roxanne is attempting to decrease the frequency that John puts his hands on other students while walking from class to class. John is able to keep his hands in his pockets. What intervention might be best for Miss Roxanne to use? As we're going through these questions, and this is something you should start practicing doing as you do practice questions, spend most of your time on the question stem. If you have to cover up the answer choices, do that, but you want to be spending a lot of time on the question. What I see when I tutor and when I consult with students is that they rush through the question, get to the answer choices, have to go back, reread the question, end up missing something, and then picking the wrong answer. We need to spend most of our time on the question so we can, one, gather all the information they give us, and two, really determine what the question is asking. So in this case, the question wants us to know what intervention should Miss Roxanne use? And what is Miss Roxanne trying to do? She wants to decrease how many times John puts his hands on other students. Now that's important. It's also important to know that John is doing this while walking from class to class. We also know John is able to keep his hands in his pockets. Reading that, we can start to say, okay, John can keep his hands in his pockets. That's a potential replacement behavior for putting hands on other students. And if John were to keep his hands in his pockets, he wouldn't be able to put his hands on other students. That behavior would be incompatible. So in your mind, you should start thinking, this sounds like a differential reinforcement type intervention. We're going to reinforce the hands and pockets. We're going to put the other behavior on extinction. So we've now done the question. Let's look at our answer choices and see if our prediction is right. A, DRO, differential reinforcement of other behaviors. If we were just putting the walking from class to class, or putting his hands on other students walking from class to class on extinction and reinforcing anytime he didn't do that, that would be DRO. DRO doesn't teach a replacement behavior. It's a dead giveaway why this is not DRO, because we're going to try to teach this replacement behavior of hands in pockets. So if we look at B, DRI, differential reinforcement of incompatible behaviors, it's exactly what we predicted. Hands in pockets is incompatible with putting hands on students. If we can do that, if we can execute a DRI procedure, we might have success. B so far is our best answer. Let's read all of our answer choices. C, extinction. Yes, extinction is going to be part of your differential reinforcement procedure, but extinction alone does not teach replacement behaviors. Extinction is a great tool. Extinction should always be used in conjunction with other interventions, especially when you're getting rid of a behavior. We need to be teaching another behavior. And then punishment to reduce putting his hands on students while walking from class to class. But what's the problem with punishment? It's not permanent, and it doesn't teach replacement behaviors. So the best answer here, what's going to teach a replacement behavior plus have an incompatible replacement behavior, is going to be DRI. So what intervention might be best for Ms. Roxanne? DRI. A parent is confused about extinction and punishment. They ask you to explain to them in a way that they can understand. If you were to train the parent, what should you be sure and do? This is part of your job. A big part of being a BCBA or BCABA is parent training. Parents are confused. It's a lot of language they don't really understand. It's up to you to train them in a way that they can not only understand it, but that they can implement it. So if you're training the parent, what is something crucial that you need to do? A, make sure you include the client in the training. Is it necessary for the client to be there during the training? No, if you're working with stakeholders, you don't need the client there. A lot of times you might be doing training while the RBT is with the client in another room. It's perfectly okay. B, what about making sure that you include the client and the RBT in the training? Again, neither are necessary. You are perfectly okay one-on-one training, just you and the parent. What about C, using technical language? Should you use a lot of language that you studied for your BCBA exam? Should you say things like extinction burst and differential reinforcement and, negative and positive punishment? Not necessarily, okay? This is technical language that they might not understand. If they don't even understand the difference between extinction and punishment, going that deep might just confuse them further. When we're talking with parents, when we're training with parents, we need to speak to them on a level that they will understand. Eventually, if you train correctly, they might get to the point where you can start using some more technical language. But if they're still at the point where they don't even understand the difference between extinction and punishment, the last thing we need to do is start throwing more technical language. We need to break it down in a simple, understandable way. So D, avoid using jargon, is going to be our answer. We need to avoid using terms specific to ABA until they're able to understand those terms and comprehend them. Speak to the parent on their level. So if you're training the parent, what should you be sure and do? D, avoid using jargon. Linda, BCBA, tracks progress of all the clients at her clinic. She determines that 70% of the clients at her clinic participate in a general education school setting. Whenever someone asks Linda about her company, she claims that almost 100% of clients participate in a general education setting. Did Linda violate any part of the ethical code? Now, this is where ethics gets a little dicey. Because you're saying, well, Glenda's not harming anyone. I mean, 70% of her clients is pretty good. And maybe she's just in casual conversation, maybe just bragging a little bit or exaggerating just slightly on her claim. Ethically, though, especially on the BCBA exam, we need to be very black and white about that ethical code. What that ethical code says, we need to apply on the exam. In real life, rarely is something black and white. On the exam, we need to be black and white. So on the exam, what are you going to pick? Did Glinda violate any part of the ethical code? A, no, there's no part of the code that mentions statements in public. Well, that is just false. The code clearly mentions public statements and plain wording, okay? B, no, Glinda only slightly exaggerated the percentage. Only slightly exaggeration is still exaggeration. And when we read our ethical code and the part about public statements, it pretty clearly states that we should not exaggerate claims made in public statements. You represent yourself as a BCBA, you represent ABA, you represent the BACB, you represent a whole lot of things. They don't want you exaggerating claims, especially about how effective treatment is, okay? So C, yes, you should not exaggerate claims in public statements. That is straight from the ethical code. C looks like our answer. What about D? Yes, she should not publicly release data about her clinic. It's up to her. If she has releases, if she's not giving away private information, she's free to do that as long as she's gone through all the necessary channels, of course. Did Glinda violate any part of the ethical code, though? Yes, you should not exaggerate claims in public statements. Straight from E5 of our ethical code, or I should say our task list. Client picks and scratches her own skin to the point of bleeding. You're able to intervene and reduce the picking and scratching using differential reinforcement and task chaining. If you wanted to determine the most effective portion of the treatment, which of the following would you avoid? Now, putting aside the nature of task chaining to reduce this behavior, we're not really concerned about that. Why? Because what is the question asking? Don't get bogged down in the details. Just answer what the question is asking. All the question wants to know is you want to determine what was most effective. Was it the DRR? Was it the task chaining? Was it the amount of task chaining? Was it the amount of differential reinforcement? What was it? But even further than that, the question wants to know, what would you avoid? So that goes even a step deeper. If you flew through this question choice, who knows what you might pick, right? You might miss key parts of this question. Slow down, really understand the question. So if you wanted to determine the most effective portion of the treatment, what would you avoid? A, withdrawal design. What's the problem with the withdrawal design in this case? Well, we have self-injury, picks and scratches her own skin to the point of bleeding. You reduced that self-injury. If you withdraw your design, you run the risk of rut. You run the risk of that behavior increasing again. Ethically, that doesn't seem very smart. So if we have a better way to do it, we probably want to avoid withdrawing an effective intervention for something like self-injury. So far, A looks pretty good. Let's keep reading. Don't stop there. B, parametric analysis, and C, component analysis. With these, what are we doing? Well, with a component analysis, we're going to find out, was it the differential reinforcement or was it the task chaining? Which one was more effective? With a parametric analysis, we're going to find out how much differential reinforcement or how much task chaining was effective. So remember, component analysis is the medicine, parametric analysis is the dosage. Both are more effective and more ethical than withdrawal design. And what about a multi-element analysis? Sure, if you're going to alternate between differential reinforcement and task chaining, yeah, technically you're going back and forth and withdrawing one intervention, but at least something else is in place. Pick the best answer. That is the goal of our exam. And clearly, a withdrawal design is going to be the worst out of these four because we run the ethical risk of increasing the self-injury. So what are you going to avoid? A withdrawal design. If you are concerned with the results of your intervention remaining consistent across other environments, you would want to measure what? All right. So thinking about the results of our intervention. When we do an intervention, a lot of times it's kind of in a controlled environment, a clinic environment, let's say. You control all the variables. Maybe your intervention is effective. We want to know, though, is that intervention going to work in school? Is it going to work in public? That's what we're concerned with, right? So what are we going to measure? Are we going to measure internal validity? Well, internal validity is going to tell us if we have control over the behavior within the environment. There's no confounds or extraneous variables messing with control. We're worried about outside of this teaching environment or this research environment, right? We're worried about external validity. We're worried about the generality of our intervention. External validity measures, hey, can your intervention work outside? Or are the effects of your intervention or the effects of the behavior change, whatever it might be, do those carry over in a generalized setting? We're really looking at external validity here. Now, what about prediction? Prediction is before the intervention, right? We're predicting what's going to happen when we do intervene. And then confounds are variables that we did not know existed that have an impact on our results. That's not what we're measuring. We're measuring generality. In other words, we're going to measure the external validity. Tokens, money, and praise are often considered what? Pretty straightforward question. Yes, some questions are easy. There's a lot of questions on this exam. Some of the questions are going to be easy. I see all the time in tutoring people missing easy questions. Why? They go too quick. They know it's an easy question. They don't take their time. Take your time. You have plenty of time on the exam. So tokens, money, and praise are considered what? Are they primary reinforcers? What is a primary reinforcer? A primary reinforcer is an unconditioned reinforcer. You don't need learning, okay, for it to function as a reinforcer. Food, water, good examples. Tokens, money, and praise. Do you need to learn that these are reinforcing? Absolutely. If you gave me money from another country, I would not know how to spend it. That means it has no value to me. Now, I know it has value just because I know what money is, but I couldn't spend it, okay? It's not going to be as valuable as American dollars. That's the way it is. So what about secondary reinforcement? Secondary reinforcement is conditioned, okay? It's learned. Tokens, money, and praise are very learned. Money, probably the most common type of secondary reinforcer. Tokens and praise right behind it. We use these all the time in ABA. B, looks like our answer. Do we pick it and move on? Nope. We keep reading all of our answer choices. C, generalized conditioned reinforcement. Now, tokens are well known for being generalized conditioned reinforcement, as is praise. Generalized conditioned reinforcement just means it's a secondary reinforcer that is generalizable, can't say that right now, to other environments, okay, or other behaviors. You can use it in many different scenarios. That's essentially what GCR is. So tokens, money, and praise are considered both secondary reinforcement and generalized conditioned reinforcement. Our answer here is going to be D, both B and C. You're working with your RBT to develop intervention goals for your client. The RBT mentions that the client will sometimes throw objects that are handed to them, so they believe that tangible reinforcement might be a bad idea at first. The RBT is considering what? Very helpful RBT is here in this situation, I should say. Get your RBT involved. Okay, as a BCBA, get your RBTs involved. They're helpful. They're smart. They know what they're doing. Most of them, right? They're around the client all the time. Get their help. And this RBT is clearly on the ball they're giving you good information. Hey, if we give them objects, they might just whip them right back at us. Okay. So we need to be careful. What is the RBT considering? Are they considering client preference? Are we worried about what the client considers reinforcing in this case? Not necessarily. What if the reinforcement is receiving that tangible to throw? That might be the client preference, but we're not concerned with that right now. Okay. Support environment. Are we worried about or concerned with the environment the client lives in, the people in that environment, the support they have? No, we're worried about the specific instance of giving them a tangible, not tangible being thrown. Are they worried about risk constraints? Sure, there is a risk. If I give them an object and they throw it back at me, that is a risk. The RBT is smartly considering risk constraints. How is our intervention going to be constrained due to risk? And then social validity. Are we worried about the outcome here? Are we worried about the meaningfulness of this outcome? No. We're just talking about what is the risk of giving them a tangible reinforcer, knowing that it might be thrown right back at us. So the RBT is smartly considering the risk before using it as an intervention. H3 is where you will find this section on the task list. I recommend going review it on the study guide. Okay. Very important part of the task list, often overlooked. Greg and Anna are told to measure how many times the client crawls under the table. Greg and Anna both measure the number of times the client runs away from the table and both record 4 instances. Does this measurement have inter-observer agreement? Hard question. IOA, inter-observer agreement. Why do we take IOA? What is IOA? IOA is 2 or more people measuring the same thing and then comparing data. Why do we take it? Because we want to see, hey, is the measurement right? Are we measuring what we're supposed to? Is the data correct? Okay. Now, that's where it gets tricky. Greg and Anna, if they compared their data, would they get the same thing? Yes, right? They measured the same behavior. They got the same number. So if they took IOA on just the data they took, does it have inter-observer agreement? Absolutely. They measured the same behavior. They got the same amount of instances. Doesn't mean it was right, but if all they did was compare their data, it would have inter-observer agreement. So, yes, Greg and Anna's data was the same. It does. You have to be careful, okay? Just because it has IOA doesn't mean it's right. Because if you look at B, Greg and Anna's data lacked validity, it did. They were supposed to measure crawling. They measured running away. Doesn't mean it didn't have agreement. They were in agreement. They were both wrong in agreement, but they were in agreement. Greg and Anna's data lacked validity, but that's not going to be our answer. Greg and Anna's data lacked accuracy. Well, we're not sure. We don't know the true value. Okay, so we can't say for sure. And then D, not enough information. We have enough information based on what we're given to know that they agree. They might be wrong, but they do agree. So be careful with inter-observer agreement. IOA is important. Okay, it keeps us honest. It keeps us on our toes, keeps us measuring and doing the right thing. But be careful, because if you're all measuring the wrong thing and getting the right answer, you're still going to show agreement. So does this measurement have inter-observer agreement? Yes, Greg and Anna's data was the same. Which of the following verbal operants lacks formal similarity, but possesses point-to-point correspondence? Verbal operant question. What do you need to know? What evokes it? What reinforces it? Does it have formal similarity? Does it have point-to-point correspondence? Formal similarity, how it looks. So, for example, spoken and spoken, formal similarity. Written and written, formal similarity. Spoken and written, not formal similarity. It's what it looks like. Point-to-point correspondence is just, is it identical? So let's say I say ball, you say ball. That has formal similarity, and what we said was identical. It's point-to-point. If I write the word dog and you say the word dog, that lacks formal similarity, but it's identical, so it possesses point-to-point correspondence. Knowing that, let's try to answer the question. Which of the following lacks formal similarity, but possesses point-to-point correspondence? We're looking for something that looks different, but is identical in what is said or written or done. Echoics. What is an echoic? I say dog, you say dog. That's an echoic. It has formal similarity. The form is the same. It possesses point-to-point correspondence. So not going to be our answer. Interverbals. Interverbals like a conversation or answering a question. I say, what's your name? You say, Dave. Does it have formal similarity? Does it look the same? It does. It's both spoken. Point-to-point correspondence? No. Textual. Textual's reading. Does it lack formal similarity? Yes. A written word and then a read word does not look the same, but it is point-to-point because it's identical. Hard concept to grasp, I know. You have to go through it a few times. You can't just read this stuff once and go take the exam. You've got to get familiar and comfortable doing these type of questions. Textuals lack formal similarity, written versus read, but possess point-to-point correspondence. You're reading exactly what was written. Kind of confusing. And then a tact has neither. Tact is not evoked by a verbal SD. Really hard question. Verbal operants really trip people up because we know verbal operants because from our RBT days or our teaching days, we know what they are. But when we get to the technical side, people neglect that. That's why I have a couple sections on the study guide with verbal operants and the details. You have to know them for the exam.